Hi, my name is Julie DeVette. You want to follow me on Instagram at JULIEDAVETTE. My hair is not even fitting in the frame. I feel like I gotta talk like this for the entire video because my hair is just gonna be cut off. Anyway, today I'm coming on here to just share with you guys some things that I wish that I would have known about labor and delivery nursing before I stepped my behind into this thing, okay? There are a lot of misconceptions about labor and delivery nursing that I just kind of want to clear the air with. So yeah, I have a whole list of things. So let's just go ahead and get right into it. I have some notes here. So if you see me looking down, that's what I'm looking at. Number one, I would say, whenever somebody asks me what I do and I tell them labor and delivery, he'd be like, oh, so you work with the babies? Oh, that's so sweet. That's not at all what we do. Actually, if I were to get pregnant and have the baby tomorrow, I would not know what to do with the baby, okay? I would just... I'm just gonna say, the only time that we work with babies is when the baby comes out, and then we have to recover the mom, and we're baby friendly, which means that the baby stays in the room with mom while she's recovering and things like that. So I know the regular vital signs for a newborn, but I don't actually do a lot with the babies. If you want to work with babies alone, that's more of like NICU. That's where the sick babies are, or the preemie babies are. They're in the NICU, and you can play with them all day. Not play with them per se. You got to be literal on here. You'll be with the babies all day. Mother baby. You're working with mother and baby, which is like the postpartum floor. So that may be more of what you want to do. Labor and delivery is more of mom and baby in utero. Mom and baby in a uterus. You get what I'm saying? That's what I deal with. When baby comes out. What a lot of people don't know about labor and delivery nursing, people think that it's like a cush job, you ain't really got to do a lot all day. No, it's not a med-surg floor where you have 5 to 6 patients. But you do have 1 to 2 labor patients at a time, and it gets a bit difficult. And if I could imagine, it's just as busy as being a med-surg nurse with 6 patients, if not more. I'm not trying to sit here and play who does the most work and stuff. I'm not trying to play that game. I'm just saying it's equivalent to having about 6 patients on the med-surg floor. You are constantly up, and you are constantly on the go. And also labor and delivery is more of a critical floor, if that makes sense. You have people who are on Pitocin, people who have epidurals and can't get up, and you have to do everything for them. It's more kind of like an ICU per se for pregnant women. No, they're not on ventilators or anything like that, but you do the total care with the patient as if you were on an ICU unit. Also, anything can roll in at any time of the day. You can have somebody who is erupting, blood coming down their legs, and you have to rush back to the OR. You have to know how to act fast in emergencies and when they do come. So it's you always got to kind of be on your toes in labor and delivery. It's kind of an adrenaline rush, and usually they're a good outcome, but yeah, you just always have to stay on your toes and ready. What they don't tell you about labor and delivery nursing is that you are a ton of different nurses wrapped up in one, okay? Especially at my hospital. You are the OR nurse. You are the circulating nurse. You are the one running around in the OR, making sure the doctors have what they need, making sure the OB techs or surgical techs have what they need, and prepping the patient and all that kind of stuff for C-sections. You are that nurse. You also are a pre-op nurse, okay? You're getting the mom ready for the C-section. You are a post-op nurse. You're helping mom recover when she's off of anesthesia. Also, while being that L&D nurse and making sure she's not hemorrhaging. Sometimes have to step in the role of a postpartum nurse, because they say if the mom's pressures are up even post-delivery, you are taking care of them after delivery, which makes you a postpartum nurse. you are an antepartum nurse, okay? We don't have specific antepartum nurses at my hospital, so I am that. You can sometimes get a med surgery patient. It's like you're tons of different nurses in one. So people don't tell you that. You wear a lot of hats as a labor and delivery nurse, I will say. What a lot of people won't tell you about labor and delivery nursing, and probably discuss with any kind of specialty, you really don't feel comfortable or confident in what you're doing and your choices and things like that. And like, it takes really about 2 years to kind of get comfortable. And even then, you still have questions, or you still might doubt yourself sometimes. Just because every patient is different, every labor is different, every recovery is different. Even the mom herself will tell you, who have had 4 kids, will tell you that each pregnancy was different. Each labor experience was different. So labor and delivery is not a predictable specialty to go in. Very rarely would you have, or do you have a, I would say, perfect or textbook labor. It just doesn't happen. So nothing's predictable. And I think that's like one of the things that was most stressful about starting labor and delivery, but also one of the things now that I kind of enjoy about it is a lot of problem solving that goes with labor and delivery. And if you don't really like that, then it may not be the area for you. Labor and delivery nursing is very, sometimes it can be emotionally exhausting and it can be physically exhausting. What I mean by emotionally exhausting is that you can have 2 patients in one day, okay? And this legit happened just a few months ago. I had a labor patient who was delivering, and I also had a fetal demise. And having to go like switch roles back and forth from trying to, be there for the mom who is going to deliver a dead baby, and then going into another room where a mom is like having her first baby, and having to juggle those two. It's 2 very opposite or different scenarios going on, and you have to know how to, when you're in this room, okay, let me turn up let me be empathetic, let me sit here, let me take time with this mom who's going through a difficult time, let me take time to listen to her. And then you come out of that room, literally walk like 3 doors down, and you're walking in there, and you have to be happy for this mom right here because she's having her first baby and, doesn't know the sex, and it's so exciting for her and all this other kind of stuff. I legit had to do that in one day, and I was exhausted, like emotionally. So just having to juggle those 2 things can be a bit much sometimes. Physically exhausting because literally there are a lot of days where you don't even really have time to eat. It's 3:30 p.m. and it's just like, I have to go get something to eat because you've been running all day and the whole floor has been running, and labors have been coming in left and right. People have been getting sent over from the clinic and all that kind of stuff, and you have to take care of all these patients, and sometimes you just don't even get lunch. And sometimes you look at your Apple Watch and you're just like, wow, I have not sat down once today, or I already have reached my 10,000 steps and it's only 2 p.m. Yeah. So that's how it can be physically exhausting. There are a lot of times that I get in the car and I'm just kind of in a trance, and I just sit there in the parking lot, and I'm just like, I don't even know how I'm gonna make it home. I'm so tired. So think about that. And I'm sure there are other professions where you just feel like nursing in general can be all of that, tiring. But I'm always speaking from the labor and delivery perspective because that's what I am, and that's what I know most about. This is what I talked about in my in one of my previous videos. If you all haven't watched that, you all can go and watch it. I have a video on how I became a labor and delivery nurse right out of nursing school and as a new grad. So that's my next thing. You can become a labor and delivery nurse right out of nursing school. You could just go and watch that video because I talked for probably like 10 minutes about that alone. So I'm just here to let you know that it is possible. And do I think that you need to have med-surg before you become a labor and delivery nurse? No, because labor and delivery is very like specific. You get what I'm saying? It's very like, you have nursing, okay? And then you have labor and delivery. I don't know why I'm doing this, but everything is going to have a learning curve, okay? I don't think you need med-surg. I mean, I'm fine without it, okay? You don't go to a med-surg floor and be like, hey, do you have labor and delivery experience? Does that make sense? Like, you know, anyway. Last but not least, labor and delivery is not as glamorous as people may think it is. You get what I'm saying? Like, it's not glamorous at all, actually. I just, you know, I was the nursing student who somehow got through nursing school without having to do anything like very disgusting. Does that make sense? So I feel like, you know, I didn't have to clean out no trach. I didn't have to change no poopy diaper of like an elderly person or, you know, a person in general. The most I did, I think, was give this old man a bed bath in nursing school, and I just remember the awkwardness of it. And so as far as nasty things that I did in nursing school, I don't have a list of those, but labor and delivery can be a little nasty. You get what I'm saying? So when patients push, you use the same muscles that you use to poop. Like legit, when I'm trying to coach somebody on how to push, like when we're first getting started, I tell her to bear down like you're pooping. And a lot of times that poop comes out, and you know, you just gotta keep on wiping and keep going. And you slowly start getting used to those things. Now, when I say that, I mean, like to this day, like, I mean, I wouldn't want anybody to give me a candle that smells like poop. And like, no. But you realize, it's like you get used to the situation and you just kind of nurse face, you know? It's just, it doesn't faze me as much as it did when I first started. So if you're worried about that, I mean, you'll probably eventually get a little used to it. Don't let them deter you from becoming a labor and delivery nurse if that's really what you want to do. I say all that to say is that labor and delivery may not be exactly what you're imagining it to be. I just wanted to throw out some things just so y'all can kind of keep that in mind. I just remember when I was in nursing school, a lot of girls wanted to go into labor and delivery fresh out of school. And when I tell you, I didn't think that labor and delivery was like this. This is not how I imagined it to be, per se. Like, it's a lot more than I thought it was. And people really talk about labor and delivery like it's just like this easy nursing job and it's just rainbows and unicorns. I do love this area, but it's a lot of work. It's a lot of work. So that's all that I have for y'all today. Don't forget to like, comment, and subscribe if you haven't already. As always, let me know what you all want to see next in the comments. And until next time, bye.